Sierra Leone is a country of 7 million people on the west coast of Africa. Its young population, vibrant culture, and beautiful landscapes hide a traumatic past. It's been impacted by years of armed conflict and other crises, such as Ebola. But despite these devastating impacts on many people, Amnesty International's research shows there's a chronic shortage in the provision of mental health care. Once a British colony, Sierra Leone eventually gained independence in 1961. After decades of political instability, a brutal civil war erupted. Between 1991 and 2002, Sierra Leone experienced an armed conflict during which tens of thousands of civilians were killed and more than 2 million people were displaced. The war was characterized by widespread abuses against civilians, including mass killings, abductions, rape, sexual slavery, mutilation, and the recruitment and use of children by all warring parties. In 2014, as Sierra Leone was still struggling to rebuild after the war, an Ebola outbreak hit West Africa. Over the next 2 years, there were an estimated 14,124 cases in Sierra Leone, including 3,956 deaths. An already fragile health system struggled to cope as health workers themselves lost their lives. Thousands of people lost their primary caregivers. Families' livelihoods were interrupted amid successive quarantines and widespread fear. And at-risk groups, such as adolescent girls, were even further marginalized and abused. But despite the terrible toll that these events have taken on people's mental health, current available services do not meet their needs nor fulfill their rights. Traditional healers remain a primary point of contact for many families, and health literacy is generally low. Amnesty International examined the long-term mental health impact of the war and Ebola on survivors. War and Ebola survivors and others in need of care and treatment face considerable barriers accessing quality mental health and psychosocial support. We recently interviewed 55 people, including 25 war and Ebola survivors across 5 districts. Others interviewed include mental health professionals and advocates in the country. War survivors spoke of their homes being burned to the ground, of being on the run for extended periods, fearing for their lives, and of surviving brutal attacks, including amputations.
The rebel then tell me make I sit on a ground. Then tell me make I put me hand on a ground. As I put me hand on a ground, now then chop me left hand. I ask them, wetin I do when make una dey do me this? Then say, if you ask one more question again, we go kill you. I beg them say, do ya for God, una no kill me. Now then say, then na God na ya, and na then they talk to we waiting and waiting for happen na ya.
Ebola survivors spoke of being so physically ill, they did not know whether they would survive. Several described the immense grief of losing multiple family members.
Them die. Na me na be the only person be dey for cover them. But only blood be dey comot from me. I fed. I dread na gone for cover them face.
They also spoke about the stigma and discrimination they faced from fearful community members. War and Ebola survivors still experience a range of symptoms of distress. Ebola survivors spoke of a persistent fear of death and of COVID-19 being particularly triggering.
I still get this idea, say, because me na Ebola survivor, I dey die just now, and I get this thing in my mind, say, I go die at any time.
The government has broken its promise of social protection, and support from international organizations has been neither sustained nor sufficient, meaning that many survivors have little to live on.
Boku tem, then one thinking forgets what we.
There is an extreme shortage of mental health professionals, and those in the profession often face stigma for doing their work.
The only counseling way we dey do now survival to survival.
The government doesn't even give mental health its own budget line, demonstrating how it is deprioritized.
We want them can support in our community, and we want people them for they talk to we get problem. Baku people and they will get still the way they monitor them. But with them kind people there, who make we know say we will get problem, we forget hope and live normal life.
This is not just a problem in Sierra Leone. Globally, only 1% of development aid for health has gone to mental health. Although, like many low-income countries, the government of Sierra Leone faces budgetary constraints, it has a duty under human rights law to request technical and financial assistance from regional and international donors to improve its mental health services. In turn, donors must step up and help. The government must also swiftly pass new mental health legislation to replace the discriminatory colonial-era Lunacy Act of 1902.